Greetings from Department of Gastroenterology and Hepatology at Columbia Asia Referral Hospital, Yashwanthpur. My name is Dr. Vidyasagar Ramappa. I'm one of the consultants in the Division of Gastroenterology here. Today I'll be discussing briefly about hepatitis B infection. As you all know, hepatitis B is a virus which is widely prevalent in a country like ours and most of the South Asian countries and Southeast Asian countries. It is rather an endemic over here, and many a times people go undetected having this virus and get to know about this virus only when it has affected the liver quite late in its course of illness. Before we move on, I'll talk more about hepatitis B virus. The hepatitis B virus is a virus that can spread through body fluids and blood. So body fluids mainly through sexual transmission and through blood transmission. So it can transmit from one person to another by means of contaminated needles when people have tattoos, or intravenous drug abusers who share needles, where it can be transmitted from one infected person to another uninfected person. So care must be taken about these modalities of transmission. Prevention is always the best form of treatment or dealing with this kind of a disease. So there is an effective vaccination for chronic hepatitis B or hepatitis B virus, which is a part of the universal immunization program in our country and many countries alike. So I would encourage all the family members to get themselves checked for the hepatitis B virus, as well as vaccinate themselves should they have any risk factors for exposure to this virus. Coming to how the hepatitis B virus causes illness in a person, there are two ways how this behaves. One is acute viral hepatitis, where a person develops acute viral-like illness, sometimes presents as jaundice as well. When it is presenting with jaundice, people do get themselves checked out and get to know about the hepatitis virus. In adults, they have a well-developed immune system, so they're able to take care of this virus on their own without the need for any medications most of the times. However, when it is affecting infants by means of transmission from the mother to the child, what is called as a vertical transmission, most so during the time of delivery, the infant who has an immature immune system is not able to recognize this virus, and this virus persists for the rest of their life, and we call this as chronic hepatitis. So hepatitis B infection that lasts for more than 6 months is called as chronic hepatitis B infection. 8 to 9 out of 10 times, our body's immune system takes care of the virus, keeps the virus under check and under control, and prevents it from getting multiplied and affecting the organ system, which is mainly the liver. And these are called as inactive carriers. Most of the times, these inactive carriers do not need any treatment. However, a small proportion of people whose immune system may not recognize the virus, or the immune system is trying to fight the virus, but the liver is getting damaged at the same time because of this activated immune system and against the virus, end up in having what is called as chronic hepatitis or injury to the liver. Over a period of time, injury and scar deposition on the liver can lead to a condition called as cirrhosis of the liver due to chronic hepatitis B infection. Also, unabated control of hepatitis B virus is also risk factors for people to develop cancers within the liver, more so in a cirrhotic liver. So once again, I would reiterate, prevention is the best form of treatment. So screening for high-risk individuals, in people who had blood transfusions in the past, tattoos in the past, people who had intravenous drug abuse, multiple sexual partners are the high-risk individuals. We also have a screening program for pregnant mothers, people undergoing surgeries, and people undergoing dental procedures, where we screen them for the presence or absence of hepatitis B virus. In people who've got active hepatitis because of the hepatitis B virus, there are effective treatments in the form of tablets with a very good safety profile, which can be used over a period of time to control the replication or multiplication of this virus and reduce the injury that can occur to the liver. So in essence, hepatitis B virus is a preventable disease. It is a treatable disease, and if well controlled, people can lead a normal life. It's only a minority of the people where it gets undetected, unchecked, can lead to significant liver health problems and liver failure, including cancer, which again can be treated by various other forms, which will be a topic for discussion on another day. Thank you.